Well, it's been a while since we had our last sit down.
It has. It's been a year or so.
I know, it's been too long.
Yeah. How are you?
I am doing well, but I want to know, how are you? I mean, Proximity continues to have this ascending rise in a category that still is requiring definition by a large part of the industry right now. And I bifurcate it two ways: the healthcare provider and then the OEMs. And you serve both.
Correct.
So I'd like to jump into the OEM side first, if you don't mind. A couple years ago, you had a JV, a joint venture with Teladoc, and you had developed an amazing back-end technology that, to me, is sort of the seed for where MedTech companies need to have that same capability and are trying to do it in-house right now. And it's not their expertise.
No.
So I'm saying all this, you're not.
No.
But I'm going to leave it there on the table for you to chat about.
I think well, thanks for raising that. I mean, it's as exciting as it is frustrating for me as the CEO of this company, and probably because it's on us that we haven't done a good enough job articulating the value of what we've actually developed. I think for so long people still categorize us as a telepresence company. They sort of put us in that bucket for various reasons. But the reality is, and as you know, over the last 8 years, we've had to go through a market annealing process. We've had to actually create the category and bring products to category within it. Is that the telepresence piece is only one application within our environment. What we built and focused really hard on doing over the last 24 or 36 months was, how do we make sure that we build a really robust infrastructure that sits between the OEM and the cloud provider? Because the cloud provider is going to go to that last mile. They want to work with players like a Proximity that then becomes the enabling system or infrastructure that turns all these edge devices, these systems that are sitting in hospitals all around the world, to cloud-connected devices through an SDK environment. But also that infrastructure enables now OEMs to say, well, I love these 3 apps that I've talked to, I really love what they do. How do we now plug them into our infrastructure? And there's this misconception sometimes that, well, it's just device to sort of AWS, or it's just device to Azure. No, you need that medium, that connectivity piece that takes you from an on-prem device to now a federated data aggregator from lots of different places, and enables you to do that at scale and globally. And then to take it one step further, how do you now start to add sophistication to that infrastructure that you can start to manage devices remotely, upgrade devices remotely. Through the collaboration, for example, with Teladoc, we were able to run a messaging portal that moves the device. And that's really where we see that operating system or digital ecosystem happening. And it took a lot of time and effort. It's a very complex thing. It seems straightforward, but the complexity is multitude. It's multifactorial. It's, of course, there's the technology itself. How do you deliver this in a seamless, easy to use way that is globally compliant, that is certified and safe? But then how do you make sure you build all the right toolings around it so you can work with the OEM so they can leverage it? So you can work with the app providers or the feature providers to plug into it. So that's what we've been doing a lot of. So we have grown definitely beyond telepresence. And it's been very, very exciting over the last, particularly 6 months, to see how many OEMs have sort of tried this and realized, why should I burn the calories to figure this out? This company's already done it. They have white labeling technology, which means I can just plug this in and build on top of it. And those are some great discussions that we're having at the moment.
Why do you think it took that long? Because the telehealth, we've stumbled around in that category for a while because it's just not a telehealth pipeline. It's not a Zoom, right?
Correct.
The complexity and the capabilities that you've built in and the categories built in. Is it ego with the mid-caps of the large strategics? Is it, we can build this here? I think I've heard recently, it's a 3 VP problem, right? Which I love that explanation. It's the first VP comes in and goes, yeah, we can do that, right? And they'll burn through hundreds of millions of dollars and it won't work. And the second VP will come in and point at it and all the reasons why it's wrong. And then the third VP comes in, meaning time, burn, money, your competitors are getting ahead of you, then come in and go, let's just ship this out and get a core competency partner to collaborate with us? Is it ego? Is it just not knowing? What is it?
Look, I think it's the challenge of a big corporate, right? I mean, they for whatever reason, and good reason perhaps in the past, felt like, why should we, hold ourselves to, an external relationship? We can just do it all ourselves. We've got of course we can build this. Like, we don't need someone externally. We'll do it. And the challenge is they've burnt a lot of calories, time, and money in certain categories, of which proximity is one example of a number, and it hasn't worked. And the reality is, and I've said this, and I think we said this at a session over 2 years ago, to really deliver such sophisticated digital enterprise solutions at scale that integrate devices, data, workflow, people, it's going to take a coalition of the willing. It's going to take a few partners that each are their domain experts to bring it forward. And what's reassuring to start to see is a lot of the providers are starting to recognize that, Proximity's been doing this and only this for 8 years. Like, they are the domain experts. Why would we try to do this? We'll take what they've got and we'll build on it. So if we as a company get them to 60%, and they can now move faster to get to 80, 90%, it's a hell of a lot smarter than having to go through 0 to 100 from scratch. And the final bit I would say is there's now one of the most important factors is that time to market. Everyone's scrambling to move to market fast. And we can accelerate time to market, exponentially, both with what we have, but also as an extended R&D arm for these players, because we've got the domain experts. They're sitting and coding in Proximity every day. And so we can work with partners and say, look, you want to build this thing, let us help you co-develop this, because you can move a lot faster. The most interesting bit, I think, of all of this will be, what do the business models start to look like around this? How do big OEMs create BD deals where it's more of a commercial collaboration / development collaboration? Some do a really good job at it, some less, some in between. But it's a learning, because software is different than devices. And so we're seeing them go on that journey as well, and we're very fortunate to be able to play a very collaborative and supportive role in taking them on that journey as well, and educating them as well on how we see the market.
And you bring up an interesting point. The innovation cycle in MedTech right now is so much more accelerated. In the 3 decades I've been at it, it's crazy. And I've had this conversation with one of the big surgical robotic companies recently, is if you think you're going to sell a robot and just leave, you're not going to be successful, because you're going to need to turn the latest edition, the latest rev, latest hardware change. And if you're not on a per click basis or a leasing basis, and you think you're going to sell CapEx, it's not going to happen. So that's one area.
Yeah.
And the other area is that I see a cross-licensing occur where there's a shared revenue stream when you bring in all of these expertise across the board, happening more often than not. And then finally, when I look at Proximity and telehealth, I think about surgical robotics and how the biggest issue most surgical robotics companies have is they can never quite get the imaging right. And they try and outperform a Storz or an Olympus or a Fuji, eventually throw up their hands
And go pull it in. Correct. And it's really interesting on robotics, and then I'll come back to the other 2 points, is we've been really fortunate over the last year to be partnering with quite a lot of the up and coming robotic companies, because they're doing a really great job at trying to build and bring to market their Gen 1 or Gen 2 robots. So they're still in the early curve of their robotics journey. To have to then expend a lot of capital to also build out their digital environment, because you got to bring a digital component to robotics these days. You can't come out to market without that digital component. It's a big lift, and it's a big cost center, and they're busy trying to get their products through FDA and all of those other things as well. And so we're really working very closely with them through our white label technology to say, let us be your digital arm. We will help you. We can accelerate. All that stuff, you don't have to worry about it. We can bring it to you. And so there's a number of companies that are doing that now. They're integrating our technology into their robotic platforms and focusing their efforts and their teams on actually getting the robots out safely, effectively, getting through their IDs, getting to FDA. And that's been really exciting, because It's all boats rise if everyone's working together to move digital and robotics and MIS at pace. And it's definitely an exciting time for robotics as well. There's a lot happening there. But the second bit you talked about on business model, I'm a big believer that business models sort themselves out. If you're doing the right thing for patients, for health systems, and for providers, you can solve all that stuff on the back end. The most critical thing and most important thing is that you build and bring to market co-developed or uni-developed technologies that are seamless, have a great user experience, and really focus on those key aims for systems and patients. It's safety, productivity, and the workforce. How do we bring these things to patients?
I want to shift gears. I want to go over to the provider side, the healthcare side. So Proximie is a multi-threat, right? So we've got the OEMs who should be partnering with you, putting that engine on the back end. NVIDIA does it, Intel does it, Proximie does it, right? Well, let's go to the healthcare side, where we've got Proximie in that OR suite, cath lab, wherever we're providing an interventional or surgical service. I like to step back from digital because one of the things with MedTech is we talk about effectiveness and efficiencies, and they're two different categories. Effectiveness is, are what we're doing right now, is it effective? And so that's a real question to ask in an industry that's been primarily analog its whole life, unconnected. And then the second part is efficiency is, are what we're doing efficient? So first, should we be doing it? And then if we say we should be doing it, are we doing it efficiently? Yeah. So are we taking these amazing digital tools and trying to stuff an analog behavior into it?
I think it's a great question. And speaking perhaps about the effective first is, in honesty, we've never really captured a comprehensive data set to really evaluate, are we being as effective as we can be? I mean, everyone wants to do right by their patients. Every surgical team I know, and as a surgeon myself, we want to do right by our patients. We want to make sure we're doing the right operation for the right patient at the right time every time. But the challenge is there's a lot of variability still, despite best efforts, despite everyone wanting, because we don't track the data in a way that is such an objective single source of truth that it becomes a true way where you can actually compare apples with apples, where I can look at cases across a geographic diversity or a heterogeneous patient diversity and say, let's look at the data and cut and splice it in different ways to really analyze what's going on. The closest we sort of got to that was registries, but that was as close as we got. So it's very hard to say are being effective because we're not actually capturing the data in a way that can really objectively determine how effective we're being. And the data speaks for itself. High variability, high complication rates still we're seeing, high mortality rate in different hospitals based on where you live. And in 2023, we should be moving beyond that. When we're so comfortable standardizing everything else that we do in our lives on our mobile devices, why wouldn't we do the same in healthcare and be as effective as we can be? When it comes to efficiency, I always, it's a very interesting word, efficiency, because it's got mixed connotations. On the one end, efficiency, when people hear the word efficiency, they're like, oh, it's cost cutting. They're cutting costs, they're going to take people away from us. What are we going to do? But it's really about doing more with what you have. We know we have a fundamental challenge in workforce that we cannot organically grow. We were never going to magically create the number of people we need to deliver the care we need. So if we start from that premise that we know we have an issue around workforce and productivity, then what we really need to be thinking about is how do we make sure we maximize, of course with quality and equity, the most that we can do with this resource that we have. ORs, cath labs, are hugely expensive assets for hospitals, and yet how much do we know about how productive we really are with them? And so historically hospitals would go hire consultancy firms, they'd go do like a 3-month project, they'd charge them hundreds of thousands or millions of dollars, and they'd come and say, here's a suggested plan. But there's no consistency and no way to keep it going. Now with Proximie being the OR digital suite that's sitting in there, we're able to capture room movement, patient flow, audio, video. We're supporting new nurses, new doctors to deliver care within that, and we're able to feed data back to health systems about efficiency and productivity. So to give you an example, and we did this across 2 geographies. We did this in the UK and we did this in the US. in a number of hospitals. On average, utilization of operating rooms is about 60 to 65%. And the remaining time, which historically was on EMR systems, which is human clicked, a nurse or someone will go and click that the case is starting, was deemed to be turnover time, which could mean anything. We dug into that data, and actually that 35-40% of turnover time, 85% of that is idle time, like nothing happening. So there's a problem around flow here, which until you see the actual video that shows you an empty OR and everyone's sitting and waiting, it's just so stark that you think, okay, we got to do something about this. And so now hospitals are loving this technology because what they're able to bring is the same software that they're investing in is helping them enhance workforce access and training, reducing learning curves and complications. It's helping them look at safety and quality, which is really important. So training, quality, safety, we already delivered that, but now we're unlocking operational gains for them as well, where we can look at flow. We can start to tell the nurse in recovery, a patient's about to come, let's make sure a bed's clear so that patient can go, so they're not being recovered in the OR, waiting for the next patient. So all these delays, whilst they seem marginal, if you can now go to a hospital and say, I can add at least 3 extra cases a week for you, at a whatever, 15, 20, 25 grand a case, that's huge for a hospital. And so it's those kinds of unlocks that we're starting to bring to the system, and you can't do that if you're just a telehealth platform or just a feature. We are not a feature nor an app, we are a platform because we bring all the capabilities that let you unlock different data products or solutions that start to unlock value for the system at large.
So when you look at the larger institutions historically, meaning hospitals, now we've got this migration of these changing centers of care. United Healthcare last week said by 2030, 55% of their lives will be managed through an ASC. And ASCs are generally run by private equity, and private equity are brilliant at rubbing the pennies out of the nickels and looking for efficiencies. So what do the changing centers of care mean to Proximie as your growth trajectory continues?
I mean, it's hugely exciting for various reasons. I mean, first and foremost, as a physician, I think it's great that now you're getting a more distributed landscape of access where patients will be able to access care closer to home. So they're not having to travel into big centers to get the care. I think from a health economics and business perspective, it's great because certain cases that are like high volume, low complexity don't need to be in high cost centers. You can now deliver those in these greatly efficiently run systems that are doing knees all day or hips all day or bariatric cases all day. We're seeing a lot of move to bariatrics in the ASC space as well. But what becomes also interesting for us as Proximie is now with a distributed network of locations, how do they stay connected? How do we still ensure quality, safety, support, training, and productivity within that? So when you look at ASC networks within an IDN, for example, being able to now have a network of experts at all different ASCs connected together saying, I need a second opinion, I need some support on this case, I'm going to send you a video, dial in, that is really interesting. But now also having a federated data set, because now all those cases aren't happening in one place, they're happening in 10, 15, 20 places. To actually try to manually go and capture all that data individually is difficult. But to now say, well, it's okay, if it's 10, 15, or 50, we'll just extend the federated access and we'll bring all that data to one place and we'll start to analyze that data in a different way. Can unlock a lot of learnings that, again, will come back to patient quality, learnings around, best procedures for best patients. And it will enable us to continue to move in the trend, which we're seeing anyway in R&D and others, is real world evidence. Now I have 15, 20 ASCs centralizing real world evidence in an anonymized HIPAA GDPR secure way where we can start to analyze product development, protocols, patient pathways, bariatric procedure, whatever it might be. And that stuff for me, both as an entrepreneur, as a physician, is hugely exciting, and I think is really the start of how we're going to see these centers play critical roles, not just in delivering those high volume, low complexity, but playing an important data role as well.
You bring up something interesting, and I had a CEO of a major MedTech company sitting here in the chair yesterday, and I asked him about his device, and he said, we're not just selling devices anymore. We're partnering now with these ASCs, and we're saying, what is the problem that you're having in the ASC? Let us help you solve the problem. And certainly companies like Stryker have done a phenomenal job of focusing in the ASC world. I'm just wondering, do you ever see a day where a Zimmer or a Proximie licensing its Proximie as that eye in the sky into all the ASCs they're selling to, and then a Stryker or a Zimmer sits there and goes, you know, we're watching what's going on in the ASC here, and we can help you with this product, and this product, because it becomes a opportunity unlock for the big OEM who has a series of products that could potentially solve a problem at that ASC or that 40 ASCs that PE firm owns. I wonder if there ever comes a day for that. And if that's a business model, I want my cut.
Yeah, absolutely. And I think that's the bit where we're trying really hard now to talk to the OEMs about, you know, think beyond the next quarter, the quarter after, you know, and of course they've got to sell their products, they've got, you know, their business to do, they have to deliver. But think about the untapped potential of a systematic value partner that can help you transform what you can offer above and beyond the product itself, especially when you are a big OEM that has an incredible footprint. If you're an OEM that's sitting in 70,000 rooms around the world, or you've got, you know, 50, 30, 40, 50% market share in ASCs, and now I come to you and I say, and I'm now going to help you connect all those rooms and be a central value partner to that ASC. I mean, that's an unbelievable potential. I could do it myself. I could go to the ASC and say, I'm going to provide the software that's going to unlock all this value, but wouldn't it be more powerful if it was a combination of an OEM saying, let me bring you this value to the market?
Nadine, they've done it before, but they've never thought about digital bundling. Right. So, you know,
or SaaS pricing.
Or SaaS pricing. Exactly. So, you know, J&J bundles, Medtronic bundles, Stryker bundles. Why can't we make a digital bundle on top of our analog bundle? Just doesn't process.
We've been having those exact conversations saying, look, forget the CapEx and the service agreement. Like, there can be SaaS top-ups to your contracts where you can start to build those either at risk or different relationships with hospitals where you go and say, let me create that. We're seeing some particularly in the imaging space that have sort of figured out this value partnership approach and are starting to build business units within their businesses that are looking at that. But now they need the tools to actually, you know, walk the walks. Like, you know, it's great branding. We want to be value partners to Hospital X. But now we as a company, as a software company, can be your tool to enable you to actually deliver something on that and to deliver it rapidly and at scale. With our domain expertise, we bring that. You have your domain expertise. At the end of the day, the ASC wants an easy partner to work with that's going to give them as much value as, you know, they don't want to manage 17 different relationships. They're busy, they're quite focused. Like you said, they're often single specialty or a few specialties. They've got to get through the work of their day.
Yeah, and they're all about efficiencies. And then the way to look at that is what's the lifetime value of that customer? And it may even be an unlock for future products that these big strategics might not even be thinking of right now.
And as you see the big strategics talking a lot about digital and trying to build and building digital teams and building digital applications, and I say this quite often, is like building digital applications, you know, I have the scars, I've lived it. You know, building applications is one thing. Deploying software applications at scale with all the certification and all the infrastructure you need to deliver it effectively is a very different thing. And so that is what we do very well. And so we become a deployment engine for a lot of these big providers that have built great algorithms, or they've bought a company that does, you know, imaging for one thing. We're like, well, we can help you now get that to market faster. We can help you update your devices all in the cloud, so you're not sending 150, 200 grand a year individuals to go out and with USB drives to try and update these devices out of hours. So I think there's a lot of potential there, and I'm optimistic. I'm seeing them moving in that direction. Obviously, I wish they were moving faster, and hopefully they'll listen to this conversation and we'll move faster, who knows?
Well, I've been with you on this journey for so many years, and I'm always admirable of you and your team's vision and commitment to it.
Thank you. You've been a great friend to us as well. We're very grateful.
Never wavers.
A sounding board for us.
Yeah. Well, thanks for the time.
Thank you so much.
You got it.
Take care.
I'm Joe Mullings from the floor of the MedTech conference here in Anaheim. Be well.